Hey everybody, welcome to another episode of The Bitter Pill. I hate to keep doing this. I'm going to have to make one more episode on uh, how some people on the left are misrepresenting uh, data about the efficacy of vaccines. And I want to talk about other things too, but we're in the middle of a deadly pandemic. In case you haven't noticed, it's killed over 750,000 people just in this country. Well over 1,500 people in the United States are dying every day. Millions of people have gotten seriously ill over the course of the pandemic or suffering from long COVID. And obviously, worldwide, things are uh, that much more of a disaster. So I want to focus once again on an episode of the Jimmy Dore show where he let me show what I'm talking about here. Um, he covered a study that purported to show that uh, vaccination rates were unrelated to rates of COVID infections across countries and across U.S. counties. Um, and the study itself, which is what I'm mainly going to focus on, is um, a very poorly done study that doesn't really, frankly, show anything. Um, but Jimmy kind of makes that even worse by misrepresenting what the study actually showed, or rather, didn't show. So the title of his video is "COVID surges among the most vaxxed communities," says Harvard study, uh, and the study actually didn't find that at all. It found no relationship across 68 countries and across 3,000 or so U.S. counties between vaccination rates and uh, COVID case rates. And there are a number of reasons why that happened, and um, reasons why it's not appropriate to draw conclusions from that type of study where you've not considered other possible factors that can influence community prevalence of an infectious disease. Um, so Jimmy plays up that this study was from Harvard. Let me show you what the study was. Uh, it's titled "Increases in COVID-19 are unrelated to levels of vaccination across 68 countries and 2,947 counties in the United States." Um, and so Jimmy plays up that this study was from Harvard, as if that in itself somehow proves the credibility of the study. Um, and I can tell you as a researcher myself, there are lots of colleges and universities in the United States and around the world that where there are people who do good research. You know, Many of which you may never have heard of, and certainly don't have the reputation of Harvard. And conversely, people from universities with stellar reputations like Harvard can do bad research. And that's kind of what happened here. So the first author of this study, um, S.V. Subramanian, is not even an epidemiologist. He's a geographer at Harvard. The second author is a high school student. And I don't want to pick on the high school student here, but in any case, so Jimmy plays up that the study was done by somebody with a position at Harvard, plays up that it was published in a scientific journal, but as you can see here, correspondence. This was a letter to the editor, and granted, the editor of this journal, European Journal of Epidemiology, did accept it for publication, but it doesn't appear that it went through the peer review process. And if it did, they did a terrible job of it because this study was not well done at all, and we'll get into that. Um, so a number of scientists have critiqued the study, which I'm going to do today as well. Um, but I just want to share with you first of all what uh, some other people have said about it. Health Nerd on Twitter, who is, according to his bio, an epidemiologist, uh, writer, writes for mainstream publications like The Guardian, well known research troublemaker. Um, he says this paper came out recently and is hugely popular among anti vaccine advocates who are using it to suggest that vaccines don't work, which, that's what Jimmy is doing in his video. Which, I'll share the link to the video with you, but I don't want to spend much time dealing with exactly what Jimmy said. I covered the main points of what he said already. Um, so Health Nerd says it's also very fundamentally flawed. I'm a bit surprised it was published. Some thoughts on it. The paper is basically a series of comparisons of publicly available COVID case and vaccine data conducted by a Harvard professor and a high school student. The study is broken into two sections. In the first, the authors took our world and data information, comparing the previous 7 days of case data between countries by vaccine rates. They produced this graph showing no relationship, note not a positive relationship as Jimmy Dore claims, between vaccines and reported cases. There are several fundamental mistakes with this analysis. The first one is, you know, confirmed cases as reported by countries are not necessarily accurate statistics. So certainly, you can imagine that in poorer countries that don't have much of a public health infrastructure, or healthcare system, a lot of cases may go unreported. They may not test a lot of people, and so just because country X shows a very low rate of COVID cases, that doesn't necessarily mean that there's actually a low rate of COVID cases. Um, so we don't necessarily know what's going on with these countries that have both low vaccination rates, mostly countries in a lot of countries in Africa, for example, have very low vaccination rates and also report very low COVID rates. So we don't necessarily know what their actual case rates are. Um, Okay, and I'll come back to the country data in my own analysis of all this, but I just wanted to have a quick look at what Health Nerd says about the county data, where the authors also did not find a relationship between COVID vaccination rates in each county and COVID case rates. And well, first of all, I can tell you that there are many studies that have been done that have found relationships between COVID vaccination rates and infection rates. That is, a higher vaccination rate is associated with a lower rate of COVID infections, at the county level here in the United States. So, um, here's some data from New Jersey showing New Jersey's least vaccinated counties are seeing 60% more COVID cases than the most vaccinated counties. The 5 counties with the highest vaccination rates combined to add 6.3 new COVID cases per 1,000 people during the period analyzed, and it was from August 1st to September 15th, as opposed to only a 1 week time frame that this study that we're talking about used. The counties with the 5 lowest vaccination rates, meanwhile, added 10.1 new cases per 1,000 people, a rate 60% higher. Here's data from New Hampshire, finding the same thing. The least vaccinated counties had the highest COVID numbers. So that's the first thing. This study's results are an outlier. They're an anomaly. In finding no relationship. And then, the issue that Health Nerd points out is that there are some curious statistics about the counties that have high vaccination rates, or some of them anyway. So Chattahoochee, Georgia has a population of 10,907, but has 30,233 people who are fully vaccinated. So obviously that's impossible, right? And he goes on to point out there are several counties where, by quite a wide margin, there are more people who are listed as being fully vaccinated than actually live in the county. And what's going on here, and it's true in the other direction too, there are counties that have very low transmission rates that record almost no vaccinations having taken place in the counties. And the problem turns out to be that in the U.S., vaccine doses are recorded based on the county where the vaccine is given, not where the person lives. So even though I live in Monroe County, Indiana, if I had gone to Bedford in Lawrence County to get my vaccine, I might, depending on how the state of Indiana does things, I might be recorded in Lawrence County's vaccine data and not Monroe County's, which, obviously that's a problem. Even at the state level, there can be problems. So in Florida, they have lots of so-called snowbirds, older people who, come down to Florida for the winter and, live somewhere up north the rest of the year. And, they tend to get recorded in Florida's vaccination statistics, even though they're actually residents of a different state. Okay, so we can just kind of dispense with the county level data right there, especially since there are other studies of U.S. counties that have found that counties with higher vaccination rates have lower rates of COVID cases. And as I've talked to you about before, if you look at U.S. states, you find a strong relationship between vaccination rates and COVID case rates. So throughout the summer in the United States, the 10 U.S. states with the highest vaccination rates had vastly lower rates per 100,000. I think it was per 100,000 per day rates of COVID cases than the low vax states, like 2 to 4 times. The low vax states had 2 to 4 times the number of cases as the high vax states, throughout the last several months. And things have, the margin has decreased within the last month or so. And likely the reason for that is that so many people have gotten infected in places like Florida and Mississippi and so forth, and now don't have high case rates anymore. And also Florida's vaccination rate has gone up. But anyway, so many people have gotten infected that they have immunity, and so between that and the 50 to 60%, 45 to 60% that have gotten vaccinated in some of the lower ranking states. You know, there's a lot of you know, fire breaks preventing COVID from spreading widely at this point in time. Okay, well, mainly what I wanted to look at with regard to this study is the data for countries. And um, let's see if I can find where I put this. I'm looking for a Microsoft Word file, but I don't see Word as an option on my screen. So, okay, I'll just go to, oh, there it is. All right, hopefully that'll come up. Yeah, okay, so as you see there, um, this study, in addition to looking at, approximately 3,000 counties, looked at vaccination and case rate data over the period of a week in 68 countries. And you know, I mean, they did list criteria for why they picked the countries they did, but I mean, why only 68 when you just picked 3,000 counties to analyze? Why would you only pick 68 out of some 200 countries? And some of the choices are kind of curious. So, for example, they um, you know, picked out, where is it? They picked out um, Sao Tome and Principe as one of their data points. How many of you know that that's an actual country? Um, I'm not sure. I'm not sure I knew that till I saw this study. And meanwhile, they left out France, Germany, and the UK, three higher vax countries, two of which have quite France and Germany have quite low rates of COVID cases. The UK is having an outbreak for reasons that we'll get into. So anyway, so they didn't find a relationship in these 68 countries, but you know, comparing uh, regions differing in vaccination rate is just not a very good way to get at vaccine efficacy anyway. Um, because there are so many variables that can affect the spread of infectious diseases. You know, uh, Before we even had vaccines, China and New Zealand and the Atlantic provinces in Canada and many other places on the planet basically zeroed out COVID completely last year, even without having any vaccines. Just a couple of months of locking down very tight and testing and contract tracing, quarantining travelers coming into the country, universal mask wearing, etc. They broke the transmission of COVID, even without vaccines. And as I've talked about before, several of these places were able to go back to living pretty normal life, until the next few infected people trickled into the country and brought about an outbreak again. But for months at a time, they pretty much lived normal life. Didn't even have to wear masks. And related to that, case rates depend a lot on how many people are visiting your country. If hardly anyone is traveling in and out, as is the case for quite a few of the low vax and supposedly low case rate countries, a lot of the poorer countries on the planet just don't have many travelers visiting there. How many of you have been to Europe versus how many of you have been to countries in Africa? I think most of us if we have traveled overseas, most of us have done the former, but not the latter. Um, so, and a lot of these uh, lower income countries in the global south also were very careful about quarantining travelers. So if you do that and you don't have many people coming in anyway, you're not going to have much COVID regardless of the vaccines. But also you may not be testing for it very much, so you might be underestimating the rate of COVID cases more than a wealthier country like the United States or the UK, which have done loads and loads of COVID tests. You know, would do. But unfortunately, one of the things that the US and the UK, among other countries, don't do so well, whereas places like China and New Zealand and South Korea do a very good job of it, is contact tracing, where you track down who may have been in contact with a person that you know is infected, so you can figure out where the disease may have spread to. Um, there's none of that going on in the UK right now, and they're having massive outbreaks in schools where hardly any of their kids are vaccinated, and they're not paying any attention to who's infecting whom, and that's why they're having a massive outbreak, despite at least among adults having a high vaccination rate. Their vaccination rate of teenagers is terrible. And they're in school without masks and crowded and poor ventilation and so forth. So you can have an outbreak of COVID with 2/3 of your population vaccinated. It's mainly going to spread in the 1/3 that's unvaccinated. And if you have them in risky situations, well, you know what's going to happen, right? Um, but on the other hand, just having a mask mandate and not having in-person school when there's high community transmission helps a lot. That's one way that places like New Zealand have been able to get things under control is, when there's high community prevalence of COVID, they are really strict. And then, once they've taken care of the virus and gotten the cases down to more or less zero, then, they can relax. But, a lot of countries in the West are not doing that. Another thing that varies a lot between different countries that has an enormous impact on likelihood of both COVID infections and COVID deaths is demographic variables like obesity and age, even meat consumption. Amount of meat you consume has been found to be related to your likelihood of getting severe COVID disease. More meat consumption is related to more severe disease. Obesity is related to more severe disease. Being older is related to more severe disease. So, if we're doing a study, comparing different countries' vaccination rates, the relationship of countries' vaccination rates to their COVID infection rates or their COVID death rates, which, we should be looking at other dependent variables besides just infection rates, right? But if you're doing that, you need to take those other factors into account. And one thing that varies enormously between different countries is age. There are many poorer countries in the world where the average age of the population is under 20. The main reason being, unfortunately, a lot of people don't live into old age. Life expectancy can be like 40, 50, 60, something like that. So, if the average age of your population is very young, your likelihood of dying from COVID if you get it is much lower than, a younger person's likelihood of dying from COVID if they get it is much lower than the likelihood of a older person dying from COVID. And not only that, it turns out, and my colleague Bob Sinclair and I have a lot of data to show this. Age is also related to likelihood of getting infected. For the same reason that it's related to likelihood of dying from COVID. Basically, younger people's immune systems, on average, work better in defeating the COVID virus than older people's immune systems do, just you know, on average. And so, not only are they not as likely to get seriously ill, they're not as likely to get ill in the first place. Um, so if you compare, countries with high vaccination rates but old populations, you know, average age in the 40s, to countries with low vaccination rates but their average age is in the 20s or even in the teens, then those two things are going to cancel each other out, and it may look like there's not much of a relationship or not any relationship between vaccination rates and COVID infection rates. When in fact what's going on is there is a relationship between vaccination and COVID infection rates, but there's also a relationship in the other direction between age and infection rates, where older average age of the population on average means more infections and also more deaths. Another factor that you need to take into account when thinking through how to compare countries' COVID infection rates and why they are the way they are is, what's been the history of that country with previous waves of COVID infections. Because if a lot of people get infected, then at least for a time, there's population immunity, on a much higher level than if you don't have many COVID cases. Now, that's not foolproof, because you have cases like the city of Manaus, Brazil, which had a very, very high rate of COVID infections very early in the pandemic. And then something like 8 months later, they had another outbreak, partly because immunity had worn off somewhat, and partly because it was a totally different variant. But if you look at a country like India, studies have found that about 2/3 of the population of India may well have gotten COVID during their outbreak of the Delta variant of COVID back from March to May to early June of this year. And India is where the Delta variant came from, because at the time India had an extremely low rate of vaccination. Every major variant has come from a country where there wasn't a high rate of vaccination at the time. The UK, for example, had almost nobody vaccinated when the Alpha variant emerged there. But anyway, these days India is doing very well, even though they don't have a high vaccination rate, because they have so many people that were previously infected with COVID back in the spring, and then now they have 52% of people partially vaccinated, about 22% fully vaccinated. So that, especially the partial vaccination rate, as well as all those people that are previously infected, means that the virus is likely not encountering many people who lack immunity at this point in time. There are all kinds of other things that you need to consider in making these sorts of cross-country comparisons. What kinds of variants are prevalent? Right now, for example, there's actually a variant related to the Delta variant of the virus that's even more infectious than the Delta variant. I forget what exactly they call it, Delta Plus or something. That's the main reason why the UK and nearby countries in Northern Europe, or some of them anyway, are having high infection rates right now. It's because they have like the most contagious version of the COVID virus that we've yet seen. And there are lots of other factors that you could that you need to think about when you're doing this kind of research. One really important one is when you happen to measure different countries. Because some locales will be right smack in the middle of a big wave or spike of infections, and others won't be. They'll either be before or after a spike. Um, and so this introduces a huge amount of error variance if you only look at things at one point in time, over the course of a week in the case of this particular study. Um, yeah, so if they were really, I mean, because you can always find, like, if you don't have enough people vaccinated um, to achieve a level of herd immunity, which it's estimated with Delta variant it'll take about 90%, and you're not doing much else either. Uh, you know, Rates of infections are going to kind of come and go, go up and down, depending on what's happening. So, yeah, if you take, say, the top 20 vaccinated countries, sure, you can find a couple that just happen to have high COVID case rates at that particular moment in time. Right now, Singapore and the UK are having a lot of COVID infections, even though Singapore in particular, and to a lesser extent the UK, have pretty high vaccination rates. But then if you look at the other 18 countries, you don't see high vaccination rates, generally speaking. Um, so, so all in all, comparing countries or counties or states or what have you, comparing geographic regions with different vaccination rates isn't the best way to get at how well vaccines work. It just isn't, because there's so many other factors that vary that have a big impact on infection rates um, and death rates and everything else. Um, so the best way to look at vaccine efficacy is to compare infection rates in vaccinated versus unvaccinated people, or compare serious illness rates or death rates or whatever. Um, the best way of all to do that is clinical trials, where you randomly assign people to either get vaccinated or get a placebo, a saline solution injection. But you know we did those back when we were testing out whether the vaccines worked or not, right? And found, yeah, they worked pretty well. The people who were randomly assigned to get the vaccinations had anywhere, depending on the vaccine, between 70 and 95% reduced chance of getting infected than the people who were randomly assigned to get the uh, placebo injection. But we can't do that anymore, because once you've proved or demonstrated beyond a reasonable doubt that the vaccines work, it's not ethical to randomly not give some people the vaccine. You've got to offer it to everybody. So, um, what's left, the best alternative that's left is to just compare people who decide to get vaccinated or decide not to get vaccinated and see how their rates of infection, hospitalization, and so forth compare with each other. Yeah, because there's a pretty good chance that they won't differ in super major ways that will affect your outcomes. Like there's not really necessarily any good reason to expect that ages or weight or whatever of the two different groups will be wildly different, and even if they're different, you can adjust for that statistically. Um, but you can't do that if you compare regions differing in vaccination rate nearly so well. Um, okay, so out of all these factors I mentioned, you might be wondering, well, how do they actually impact the relationship that you find between vaccination rates and COVID infection rates? Um, well, I happen to have some data on that very thing. Um, so what I did was I collected data on you know, vaccination rates and infection rates over a period of a week, per 100,000 people is what the statistic is. And I collected data on 96 countries, including the vast majority of the ones that Subramanian and Kumar looked at. Um, and then just split them into higher vaccination rate countries and lower vaccination rate countries, and compared both their you know uh, rate of COVID cases if they had received their first dose of the vaccine, and also compared their rate of cases if they were fully vaccinated. Um, and so here's what I found. Let's see. Let me go to this. Um, so almost twice as many people over a period of a week were infected with COVID in per 100. No, wait, that's per million people in countries that had lower vaccination rates, the lowest half of those 96 countries. About twice as many people were infected uh, you know, per million than in countries with higher vaccination rates. And the numbers up at the top, F is your statistical test that compares these two groups and tells you whether or not you're likely to have gotten a difference this big between them just by chance. As you can see here, the standard deviation, the amount that the rates of COVID infections varied within the countries in each group was quite high. So even though it's almost a 2-to-1 difference, it's just barely a statistically significant result. Probability of 0.03, which, I mean, that's good enough. 3 in 100 chance that you could have gotten a difference this big just by chance. But watch what happens if you factor in the average age of the people living in the different countries. Okay, so same numbers, 1,940 cases over the course of a week per million people in the lower vax countries, 1,022 in the higher vax countries. But these statistics here just jump up because median age is highly correlated with rate of COVID infections, and in the opposite direction from vaccination rate. So the older the average age of people in a country is, on average, the higher their infection rate is going to be, because older people's immune systems don't work as well. But the more vaccinated countries have much lower infection rates, and you can really see that this difference, 1940 versus 1022, is a big difference when you factor in the median age. So your F statistic jumps up from 5 to, was it 4 or 5? 5 to almost 14. Less than a 1 in 1,000 chance that this difference, 1940 versus 1022, could have happened by chance. Okay, well, let's look at full vaccination rates. Not quite as big a difference for some reason, just a couple of countries randomly being in the other group reduce the difference. 1,868 cases over the course of a week per million people. In the low vax countries, 1,097. In the high vax countries, not as big a statistical difference. Probability of about 7 in 100 that you could have gotten a difference as big as this, 1,900 or so versus 1,100 or so, just by chance. But again, look what happens when you enter age into the equation and take into account the fact that more vaccinated countries typically have older populations, because they're wealthier, people live longer, etc. And we know that therefore that's related to having more COVID deaths. As I've talked about many times on this show before, richer countries are having much higher COVID deaths because they have more older people, and also because they're more careless about protecting people on average. But so look what happens if you factor in median age. So same numbers, average of a little under 1,900 uh, cases over the course of a week per million people in the lower vax half of the countries, about 1,100 in the higher vax half of the countries. But, uh, you know, because median age is so highly correlated with infection rates, um, you know, the effect of the vaccines really shows up powerfully. Probability of less than 1 in 1,000, again, that you could have gotten this difference, 1868 versus 1097, just by chance. Um, okay, well, let's see. And same thing with deaths. Bigger effect of vaccinations on death rates. Um, and again, the effect looks bigger if you factor in average age, but it's already a big effect. Probability of only 2 in 1,000 that this difference here in death rates between the low vax countries, 23.8 people dying per million population over the course of a week in the low vax countries, 8 per million dying in the high vax countries over the course of a week. Um, so almost a 3-to-1 difference there. But that 3-to-1 difference looks more impressive when you consider that countries with older populations, on average, have, other things being equal, have higher COVID death rates, which is the opposite pattern from the relationship between vaccination rates and COVID death rates. And, you see the same thing with FV stands for fully vaccinated. So, 2 in 1,000 probability that this difference is, a real one, or is not a real one and just happened by chance, I should say. So, almost certainly a real difference there. But, when you factor in median age, the difference looks all the more impressive. Probability of, I would say well under 1 in 1,000 that this 3-to-1 difference here between the death rates in the low vax countries and the high vax countries could have happened by chance. Another way you could do this is you could, instead of comparing countries all over the world with all the many differences between them in terms of average age and government policies and so forth, you could look at a more restricted region, and then maybe something like median age wouldn't matter so much. Okay, so that's what I. Where are they? Okay, I'm gonna have to find another folder here. Yes. What if we just look at Europe? All fairly well-off countries. None of them have extremely young populations like you find in parts of the global South. So just comparing, most of the European countries, there were like 5 or 6 that I couldn't get data for one or the other of the variables. In terms of that same statistic, weekly average number of cases of COVID per million people. The low vax rate European countries had about twice or more than twice the rate of cases as the higher vax half of the distribution. You know, Pretty clearly meaningful difference there. Probability of about 2 in 100 that you could have gotten this 2-to-1 difference just by chance for these 37 European countries. And, it makes some difference. Let's see. Did I? Yeah, I guess I didn't put the image of, if you covariate out age in this folder. But it did improve the statistics a little bit, but not a great deal. because you know uh, you're not talking about as big a range of age differences if you look at European countries. So you know uh, you just find the difference straight out. Uh, 0.02% or excuse me 2% probability that this difference could have happened just by chance. So, you can be pretty sure it's a real difference in infection rates between high vaccination European countries and low vaccination European countries. And it looks much more impressive if you look at deaths. You know, 48 deaths over the course of a week on average per million people in the lower half of the European countries in terms of vaccination rate. 9 um, with a higher vaccination rate countries, and very very big difference there. Okay, well, again, this isn't the best way to investigate, um, you know, efficacy of COVID vaccines anyway. But if you do it right, instead of doing it wrong, as Subramanian and Kumar did, you can find something there. You just have to be careful to take into account factors other than vaccinations that influence you uh, infectious disease outbreaks, because there are many of those. Again, China and New Zealand and some other places controlled COVID without vaccines last year by locking down and contact tracing and having mask mandates and so on and so forth. But you know, you can find things if you approach those data in the right way. But what if you do look at a better uh, form of data for um, getting at rates of COVID infections in vaccinated versus unvaccinated people? Well, you can look specifically at vaccinated versus unvaccinated people, and you not worry about comparing geographical regions. Um, so so the clinical trials showed, as I mentioned, 70 to 95% reduced rate of COVID infections in vaccinated versus unvaccinated people. But there have been dozens of studies comparing infection rates in vaccinated and unvaccinated people since those clinical trials took place and since the Delta variant became the dominant variant, the roughly twice as contagious variant of COVID that we have circulating about now. And almost all of those studies show that the vaccines reduce infection rates, you know, compared to unvaccinated people by a huge amount, almost as much as with the original or earlier variants of COVID. So I'll just mention a couple. A study from Malaysia found that uh, vaccinated people, huge sample in this study, 14.5 million participants, vaccinated people had a 88% lower likelihood of getting infected with COVID and 86% lower likelihood of developing a symptomatic infection as opposed to an asymptomatic one. And the statistics were even more impressive as far as preventing people from dying or having to be hospitalized in the intensive care unit. Well over 90% in terms of that. And tons of other studies from many different countries all over the world, several from the United States, all showing massive reductions in infection rates in vaccinated people as compared to unvaccinated people. But of course, um, 85% or 90% or whatever it is not perfect. Well, what happens if you do get infected with COVID despite being vaccinated? Um, well, some people have gotten this idea in their heads based on some not very well thought out messaging from the Centers for Disease Control, where people have mistakenly arrived at the conclusion that vaccinated and unvaccinated people are you know infected with similar amounts of the virus and therefore are equally contagious. And first of all, you have to get COVID to pass it on to somebody else. If you don't have it, you can't transmit it. And vaccinated people are far less likely to get infected in the first place, as we just talked about. But also, if they do get infected, a number of studies have shown that they're not as infectious for a couple of reasons. First of all, you know, um, the studies that have looked at viral loads have not and found that they were similar in vaccinated versus unvaccinated people have not looked at what the actual content of that viral sample was. And studies that have, such as a study from the Netherlands, have found that people with breakthrough infections who are vaccinated have a smaller quantity of infectious virus than unvaccinated people who are infected, on average. And their viral loads decline faster than unvaxxed people because they're not getting as serious a case of COVID on average. Obviously, there are exceptions to the rule, like Colin Powell, who had compromised immunity, but in general, people who get infected with COVID despite being vaccinated have far less serious cases of COVID than unvaccinated people do on average. And therefore, on average, their rate of transmission is lower. Not zero, certainly. So there's a good reason why the CDC changed its badly mistaken guidance on masks that said it was okay for vaccinated people to be around complete strangers without masks in public indoor spaces. That was a stupid idea because you can infect somebody else if you're vaccinated and you happen to have a breakthrough infection of COVID. But the point I'm making here is A, you're less likely to get infected in the first place if you're vaccinated, by something like 85% less likelihood on average with the Delta variant of COVID. And, if you do get infected, you're less likely than an unvaccinated person to pass it on to somebody else. There are many, many studies that show, both of those things. So, in conclusion, I don't think that folks like Jimmy Dore and Kim Iverson and Fiorella and Pasta, the Convo Couch, and so forth, that are you know, cherry picking out data that suggests that vaccines aren't effective. I don't think they have bad intentions. Um, I think they're just misinformed, not very scientifically educated, um, and you seem to have this very sort of individualistic ideology where individual liberty to do whatever the hell you want takes precedence over everything else. So, um, you know, you shouldn't have to be vaccinated even to go into a place where you're packed together like sardines with other people who uh, you could infect. Um, and you know, I mean, we live in a society where we try to take care of each other, and individual rights stop at the point where you're interfering with somebody else's right to, for example, not be exposed unnecessarily to a virus that could make them very sick and possibly even kill them. Um, Granted, if you're vaccinated, you're not as likely to get seriously ill with COVID as if you're not vaccinated. But I mean, who wants to get sick? Don't I have the right to not be around infected people if I don't want to be? Um, you know, um, and again, not that people that are around you can't be infected if they are vaccinated. Of course, nobody's saying the vaccines are 100% effective. It's just a matter of odds. It's a matter of likelihood. Um, and the odds that people are going to be protected if they get vaccinated are high enough that it does, in my opinion, make sense. Especially since this is a very serious virus, to take whatever steps we can to protect people. Um, Another thing that seems to happen with this rather large segment of the American left is um, there's this sort of knee-jerk anti-establishment impulse that's well-intentioned and is usually correct, but it leads people to be automatically suspicious of things that it doesn't necessarily make sense to be suspicious of, like new vaccines, for example, where, okay, at first you might wonder, does it work or not? But then you have all this data coming in, 7 billion vaccines given all over the world and all these clinical trials showing that it works and it's safe and so forth. At some point, you've got to start trusting scientists who have done this research and, trusting the research itself more than the people who did it, I guess. And not just assume that big pharma is up to something nefarious in making the vaccines. When really what's going on is, like any other capitalist enterprise, they're trying to make money. And there are different ways you can make money. You could make money by ripping people off, charging them an arm and a leg for a product, or you can make money by making a high quality product that lots of in the case of vaccines, lots of countries are buying it. So you're making lots of money from distributing lots of vaccines. And of course, they're competing with non-capitalist entities like the Chinese and Cuban governments that have also manufactured high-quality vaccines. Now, do you think that Pfizer, BioNTech, and Moderna and Johnson & Johnson, who make the vaccines we have in this country, do you think they don't want to compete with the Chinese and Cuban and also Russian vaccines made by the Russian government? Of course they want to have a product that is commercially successful because it works well. There are also financial incentives for pharmaceutical companies to do lots of bad things, like try to hide it if they screw up, or charge an arm and a leg for their vaccines to poor countries that can't very easily afford it and refuse to give them access to the information that they would need to make them themselves. That's exactly what's happening right now, and it's a terrible thing. And fortunately, for countries that can't afford Pfizer's rates or don't have the refrigeration equipment to store an mRNA vaccine until it's used, they have other options. They're mainly getting their vaccines, if they have gotten a hold of them yet, from China and Russia and Cuba. But finally, I just want to point out that we all have this tendency, which we psychologists call confirmation bias, where we believe something is true, and we have a tendency to cherry pick information that appears to back us up. And that's exactly what Jimmy Dore did in this video, and has done lots of times, and so have other people that are kind of skeptical of the vaccines or what have you. Cherry pick out two countries with high vaccination rates that have high COVID infection rates and ignore the other 20 or whatever that don't. Um, you know, or as Max Blumenthal did, pick out a university with a high vaccination rate like Duke University, and go, aha, they had a COVID outbreak, a few hundred cases, and that must mean the vaccines don't work. Meanwhile, ignoring that that same university has in recent weeks had almost no COVID cases at all, and the same is true of the vast majority of universities with high vaccination rates. They're not having big COVID outbreaks despite having in-person classes and living in dorms and so on and so forth. So, if you look at the big picture, it's pretty evident that the vaccines are working pretty well. Now, it's kind of human nature to exhibit confirmation bias in the way we go about gathering evidence regarding our opinions. We tend to pick out evidence that we believe supports them and ignore evidence that doesn't. It's human nature. But this is a situation where lives are on the line. 750,000 plus people have died in the United States. Our life expectancy has dropped by almost 2 years. Millions and millions of people have gotten seriously ill. Globally, 5 million or so people have died. Tens of millions have gotten very sick. This is not a situation where we want to, let our judgmental biases get in the way of evaluating the situation clearly, because there's lives on the line. And it really isn't okay to refuse to reconsider a position that being against vaccines, or at least against their being required in higher risk situations, such as crowded indoor public spaces. You need to think very carefully about the evidence before you arrive at a conclusion about this. And when I see people not doing that, I'm going to keep calling it out. All right. Thanks for watching. I will see you next time.